What is a kidney stone?
A kidney stone is a stone that forms in your kidney, and sometimes these drop down and block the kidneys. Sometimes they can lead to infection or pain.
What causes kidney stones to form?
There can be lots of reasons why kidney stones form. Most of the time it's because of low fluid intake, people not drinking enough fluid, so it just allows the stones to form in the kidney. There can be rarely some conditions or medical issues associated with forming stones, but in the majority of time it's because of lack of fluid.
Do any of my medical conditions put me at risk of forming kidney stones?
Not really, it's not that common that we see that. Sometimes with people who have had major surgery on their abdomen to remove parts of their bowel, or some people who may have inflammatory bowel disease. Things like that can lead to the formation of stones in particular individuals. Rarely people are born with an inherited condition that makes them form stones, but for the most part, we see people form stones for no apparent reason.
What are my chances of forming a kidney stone having had one?
Unfortunately, the stones recur quite a lot, and over 5 years you have a 50% chance of forming a new stone in that period, which can cause pain or symptoms. So prevention is really important in terms of preventing your stone, to try and prevent them from returning.
Are there different types of kidney stones?
There's lots of different types of kidney stones, but nearly 9 times out of 10 it's the same stone. It's called a calcium oxalate stone. This is the most common type of stone by far. The other rarer types of stones are associated with specific conditions, and we don't see them that commonly.
What symptoms should I look out for my kidney stone?
Most of the time they'll cause pain, and this pain, if you've had a kidney stone, you'll realize is quite severe, quite significant. You probably would end up in the emergency department with them. For people who've never had a kidney stone and they're presenting for the first time, this is quite a difficult and challenging time for them because they don't know where their pain is coming from. If you've had a stone before and you're returning, you'll have some familiarity with what may be going on. But for the most part, it's a severe pain. It can be quite mild, such as pain in your back or pain in your tummy, and sometimes they can lead to infections, be it mild or severe infections, and sometimes you might see blood in your urine.
What tests did you do when I presented to the emergency department with my kidney stones?
When you come in initially, depending on the situation, there will be various amount of tests going on for infection and things like that. But in terms of just the stone and the kidney stone, most of the tests we perform are what's called a metabolic profile. It's a panel of bloods that are checked, such as your calcium and other bloods that check your hormones. And this is just to rule out the very rare situation that kidney stones are formed because of a hormonal imbalance.
What imaging will I need to diagnose my kidney stones?
Most of the time, either a CT scan or an X-ray or an ultrasound will be performed, which diagnoses this kidney stone issue very well. If you come in with pain, you'll end up getting a CT scan, and this tells us exactly how many stones and where they're located.
Are there any medications I can take to prevent kidney stones?
Not really. It depends on the situation, and people who are commenced on medications for kidney stones, it tends to be a very specific problem. We'll only commence medication in people who have very troublesome stones that keep reoccurring, and there's a specific problem identified in their blood or their urine. For example, too much calcium in their urine, or conditions like that, where we can manipulate the environment that the stone could be forming. The reason why we don't do this with everybody is these medications that are placed, or these medications that you might start to prevent stones, can have a side effect profile of their own. So you could potentially get side effects from medication. So we don't like starting everybody on that. And for the most part, it's really just about addressing your fluid intake, which is the best preventer for stones.
Do I need to do anything to change my diet for my kidney stones?
It's really important that if you're a kidney stone former, that there is 2.5 to 3 liters of fluid in in your daily diet, and that's the only thing that is really proven to prevent stones. You want to avoid salt, and everybody will say that there's no salt or little salt in their diet, but when we look at their urines, there's a huge amount of salt in them, and that's because salt is coming at you from loads of different directions that you're unaware of. And any food given to you from a restaurant, in a processed or packaged food, delicatessen, they're heavily, they have a heavy amount of salt in them for seasoning and flavor. And this is the reason why you don't realize there's so much salt in them. And this salt is important because it's swapped out for calcium in your urine. So if you have a diet that's high in salt, you can end up producing a lot more calcium into your urine, and this forms stones.
Do I need to change my lifestyle to prevent kidney stones?
Body weight is quite important in terms of kidney stone prevention. So losing weight, exercise is a good preventer of stone. A diet that's well balanced with fruit and veg especially is quite protective. So losing weight and having a good body weight and increasing the fluid into your diet, lots of fruit and veg, they're the things that will have the most benefit.
How do you decide who needs kidney stone surgery and who doesn't?
That's usually fairly straightforward to us. You'll either come in through the emergency department and we'll diagnose the stone blocking something or big enough that it warrants the surgery. So in that situation, it can be very easy to advise you on that. Sometimes you might present to the clinic and you're describing some pains, and we'll diagnose a stone that isn't quite causing those such severe symptoms, and they might be stones that need surgery.
I've had my surgery and now I have a stent in. Can you tell me about my stent?
So this is a stent. It's a type of plastic tube that's placed from the top to the bottom of your body. So this bit is in the kidney, and these curls just keep it within the kidney. These curls are in the bladder, and it just stops swelling in your kidney. It stops your kidney from blocking off, helps prevent getting infections. And we place it temporarily until the kidney stones problem is solved. So you may have a stent placed if there is infection, and that'll help us get on top of that with a view to surgery down the road. We may have completed your surgery and replaced the stent afterwards, and it's done to prevent swelling, and we'll remove it in a week or two. Or you may have your surgery performed but it's incomplete and you need to return another day for more surgery to try and eradicate the stone, and it'll be placed for a little longer period in that situation.
How do I remove my stent?
We can remove it in a number of ways, but you might notice that we've left these strings on the outside of the stent, and these strings are attached to the bottom end of the stent, and we may ask you to pull that out yourself. If you don't like doing that yourself, we'll bring you back and one of our team will do that. But if you are pulling it out, you simply just hold this string and pull firmly. Don't jab or pull quickly like that. You want a slow, steady pull. And what you'll notice is the stent coming out of the urethra, which is the water pipe, like that, and it'll pop out. So that's how you remove it yourself. You'll see it's about 30 centimeters long, so it's reasonably long, but a slow, steady pull. It's very quick. It takes maybe 5-10 seconds to pull out, and it's a little uncomfortable, but tolerated very well.
I had a lot of pain from my kidney stones. What is the best medication for pain management?
You'll have to weigh that up yourself, but if you're having pain after surgery, paracetamol and ibuprofen could be the best. Take some advice about the ibuprofen. If you have a kidney blood test that shows that it's slightly abnormal, we may advise you not to take that. If you need something more or stronger, we'll give you some of the morphine type medications that may help you with that.
My stone was sent off for analysis. What does this mean?
Unfortunately, the stone analysis doesn't really give us information that changes things drastically, because we know most people form calcium oxalate stones, so most of them come back as that. We do send them off just to identify the more rarest types, or just to confirm that you have a calcium oxalate stone, but we're able to when we look at the stone, we're able to tell fairly confidently which type it is. We don't always send the stone for analysis because it can add to the complexity of your operation, trying to pull something out. It's a little safer not to do that sometimes. So it's not hugely important to send it off for analysis.
Does reducing calcium in my diet have an impact on my stone formation?
No, you shouldn't really reduce it. You should have a well-balanced diet that has a moderate amount of calcium, such as milk, cheese, etc. If you restrict your calcium completely, actually you'll get more stones. It's worse for you to do that. That's something, if you feel that there's a lot of calcium in your diet or no calcium, you need to bring that up as a discussion point with us, and we'll give you some advice on that.
Can kidney stones have a long-term impact on my kidneys?
They can, if they keep reoccurring and they keep blocking your kidneys, they can affect your kidney function over the course of your lifetime. So it's very important to be proactive about prevention.
If I want further information on my kidney stones, are there good resources available?
Yeah, there's a few good websites. We will give you the names of these websites to look up. It's worth really delving into that, looking up about your own stones, looking up about prevention, because they come back a lot. They can be very painful and uncomfortable, going through the experience of a stone blocking or even surgery. And prevention really works. So it's really worthwhile looking at those websites and learning as much as you can about kidney stones.